And welcome to the Shatkin First Monday Morning Minute.
Good morning and welcome to this Monday Morning Minute. I'm Dr. Todd Shatkin, and with me is our patient Bill, who went to high school with Tom Fitzpatrick. So this is Fitz's friend, and he's been nice enough to volunteer to let us videotape him today. We're going to be extracting tooth number 3 and placing a couple mini implants up there, and then we're going to do number 31, the same thing. He had root canal on both of them. He's definitely a bruxer, and he's worn down his teeth quite a bit, but we're going to try our best to take care of him here. So I'm going to go ahead and get those teeth out. First, we'll start number 3. Turn your head a little that way. Okay. A little pressure. If you have any pain, you tell me, okay?
Mm-hmm.
Location. That's a large one. I want a little one. Smaller one. This is a big one. Let's see.
I'm going to check really bad. How do you bite for a bottom off, okay? Then you're going to come back in the mouth and just say, we told us that no control is going to get some time.
See, this is a little one.
A lot of pressure.
Does that hurt?
Mm-mm.
There's pressure?
Mm-mm.
Okay. There's one root. There's 2 roots. And there's one more on the palatal.
Nothing.
Let's see if we can grab that one. It's a little hard to grab that. Let's see. There it is. Root number 3. All right. So let's get that granulation tissue out. Okay. Do you have the implant sizes?
No.
So you see that there's some nice interseptal bone here. So we're going to place the implants right in the interseptal bone. And it's a little hard to get in there because of the adjacent tooth. So I'm going to use a drill extender. That'll give me a little more space. So that's my drill extender. We're going to place an implant on the distal and mesial. There's one hole, another hole.
2 holes.
And again, we'll use the drill extender to place it just so I have a little more space. And I can visualize a little better. So here we got our implant. Set the handpiece to setting number 2. And we got a nice beep at 39 centimeters. Okay, we're going to go ahead and put the second one in. I'll take a piece of Restore Plus bone. Restore. The newest product from Shatkin First is our Restore Plus bone grafting material. And here we got nice density there. We're going to go to 60 Newton centimeters. It's beeping at 60 too, also. So we got 2 implants in. Now I'm going to take the Restore Plus. Here's a Restore Plus bone plug. And we're going to plug that into the socket there.
Tomorrow they start training camp. Tomorrow, huh?
These are the red helmets?
For the last
Okay, we're going to pack that socket. There's not too much to pack over here. Let me have a little hemostip.
I'm excited. I went to Uniform Geneva, right?
Yeah.
Did my engagement photos at the
Oh, they did?
So that's our hemostip gauze. We're just going to pack that in the socket. That's going to help to let the socket heal as well.
Yeah, I'm cut on my uncle. I checked it for 30s, whatever.
Put it right here, okay? Then we're also going to put it right on top of the bone.
40 rows up.
That's kind of where we used to.
Right, so they had to move. They told me they moved over a little bit because of the you know what I mean? They went to the next one over. They were real high right there. Probably the highest, you know, right at
Well, you
that
can
spot.
see
Okay. Very good. All right, we'll put a couple healing caps on there. And we'll make our temporary. These are the plastic healing caps. And we'll snap it on. We have that.
Yeah, right.
We're going to have to trim that a little bit. Very often, if the implants are a little too close together, it's a very easy fix. We just trim the healing cap and make it a little more room for us. So I'll just take a little bit off from the side here. And then we'll be able to slide that in without too much trouble. There it is. Okay? 2 healing caps are in there. I still like to tap on the implants. Even though we reached 30 Newton centimeters of torque, still make a little tap on there. I take a little ball of composite, maybe a little bit more. I should have taken more to begin with. Sorry about that. Okay. So we make a little ball of composite, flatten it out into the shape of a molar, and we just stick it right over and wrap it over. You able to get that, John?
Mm-hmm.
Okay, bite together. All right, open. And this doesn't have to be perfect. It doesn't have to be an occlusion. It's really a Band-Aid. It's to help to protect it while it's healing. Okay. All right. All right, we'll go ahead and do the bottom now. Turn that way a little bit. You starting to feel numb down here?
Uh-huh.
Lip is numb?
Uh-huh.
All right, perfect. All right, now we're going to remove the 2 roots on the bottom. There's 1 root. And the second root coming. A little vertical pressure into the ligament space should loosen up the root pretty easy. Here it comes. Just like my oral surgeon professor in dental school said, two things cannot occupy the same space. So if you put the elevator down the root surface, along the root vertically, the root will pop out because you can't have a root in there and the elevator. So we push down and it just pushes it right up. So now we're going to go ahead and do the implants on the bottom. And let me pick the size. We will do the same size, 2.25/11s. You got them? Mm-hmm. Perfect. Okay. So we're almost done here. Bill, you're doing great. Do you have any stories about fits you can share with us? Jeez.
What's that?
Any high school stories about fits?
No.
I'm kidding. Okay, open. I'm sure there are some. I know a few. You know, I told you I was at Amherst High School when you guys were at South, but I had some friends at South. Open real big. Gotta find the hole I made. Let's see. Let's see. Not always easy to see in there. Let me see. Open real big. All right, so we're beyond. Let's see, section there. Those are 60 centimeters. I'm just not gonna look at something here. I'm going to try a little different spot here. Let's see. Okay, let's see. You need me to leave that? Okay. What happened? All right. I'll be right there. Okay. All right, we're going to pause for 1 second. So in between placing those last two implants at number 31, I stepped out of the room to finish up with the new patient who I had started doing a consultation on previously. He needed an upper roundhouse for $19,500. Actually, the normal price is $21,500, but I had given him a discount, got it down to $19,500, but it was still too much for him. He's going to put $3,000 down and finance $16,500, but the payment was too high. So I went in there and I talked it over and reduced the price. He told me he could afford $200 a month. We got him approved on Proceed Financial for the amount of the whole amount, but he just couldn't handle the payment. So what I did is I went in there and I worked on the payment with him, and we got the payment down to the $200 a month to make it work with him. Well, listen, I gave him a little better discount, but I took care of the patient and we got him approved. So in total, we're doing a little bit less work, but he's going to pay the $14,500. So finance $11,500, and he's going to pay $3,000 out of pocket. So anyway, I just want to let you know, I still do that chairside. I still help patients figure out financial commitments so that they can afford their dental work. After this, I'll talk about that. Open for me. All right. One more.
Oh, not that way.
One more implant here. On the Go extender. Hard to reach area in the back there. But we'll get it. Oh, it's already 20 to 5? Wow.
Oh, what the hell?
It's getting late. Okay, let's see. How'd the day get by so quick? Bite together. Oh, open it. Jeez. Oh, don't bite. Okay, now bite. Bit your mirror with my finger. Okay, bite again. All right, perfect. Okay, Sonny, you can take it from here and put a temporary on there. All right, so in about, 20 minutes, we've extracted 2 teeth, placed 4 mini implants, and 2 temporary crowns.
That's good.
Thanks for joining me on the Monday Morning Minute.
And don't forget about the International Academy of Mini Dental Implant Symposium at the beautiful Four Seasons Hotel in Orlando, Florida. And we are going to have a lineup of speakers like never before. We have a few seats left, so sign up today. Remember, 50% off. Take advantage of that great special, and we look forward to seeing everyone down in Orlando, Florida, August 1st and 2nd.